very good evening to everyone here in person, which is something that's absolutely wonderful. That 4 days, 4 years ago, we've all been meeting here. It's good to be able to see families, to embrace people, and those who are out in especially, and something that we're used to that. And we're absolutely committed to the facility for the Univerity. To be used to here, both of us are to be university. Gently. So for us, it's a really privilege and example. Because not only we're in the building, which is being restricted for a really nice way to see experience, culture, in a number of activities, and in front of a river which has been changed in the course of testing which is very nice, and you'll be able to see them developing the handles as we are walking and doing the conference between those spaces. So please hear this as like a space. This is what we are all about, and we're very, very privileged to receive today the mayor of Valencia, please,
Buenos días, bon dia. Rectora de la Universitat de Valencia, Secretaria Autonómica de Arquitectura Bioclimática y Sostenibilidad Energética, Presidente del Congreso, Directora Ejecutiva del Congreso, participantes en esta conferencia internacional, autoridades, señoras y señores. Es para mí un honor darles la bienvenida a esta conferencia que desde hace 20 años viene impulsando la Sociedad Internacional de Salud Pública, para poner de relieve los mejores ejemplos mundiales de ciudades y gobiernos locales que están transformando sus entornos físicos y sociales para mejorar la salud y el bienestar de sus residentes. Durante estos días, Valencia acoge a los principales investigadores, profesionales y responsables de las políticas de salud urbana de todas las disciplinas y sectores del mundo, con el objetivo de traducir la investigación en políticas, programas y efectos positivos, mejorando la salud y la calidad de vida. La conferencia vuelve a ser presencial por primera vez desde 2019 y va a ser una gran oportunidad para que los más de 500 asistentes compartan investigación de vanguardia, ideas innovadoras, historias y ejemplos sobre el terreno en Valencia sobre cómo impulsar la salud urbana. Como decía al principio, para nosotros es una especial satisfacción que Valencia sea la anfitriona de esta conferencia de salud urbana, pues para nosotros la idea de ciudad saludable es fundamental. Así se refleja en nuestra estrategia urbana Valencia 2030, que considera la salud como un elemento transversal en el desarrollo de todo el conjunto de políticas públicas. Para nosotros, la salud es mucho más que la ausencia de enfermedad o la actividad de los servicios sanitarios. Es algo que puede crearse si el entorno donde vivimos nos facilita estilos de vida más sanos. Y ello es necesario tener en cuenta los determinantes sociales de la salud, como conjunto de circunstancias en que las personas nacemos, crecemos, aprendemos, vivimos, trabajamos, envejecemos, y que junto con el sistema de salud explican la mayor parte de las desigualdades en salud. Y es necesario tener en cuenta también que la ciudad es el lugar donde toman forma todos estos determinantes. Por tanto, las políticas urbanas son, en esencia, políticas de salud. Así lo hemos entendido en Valencia, porque aspiramos a que el código postal no determine la salud de las personas, ni tampoco lo haga el género, la etnia, la edad, la clase social o el estatus migratorio, y que todos los barrios sean entornos saludables, con aire limpio todos los días del año y libres de contaminación, residuos y ruido perjudicial. Estamos contentos de ser la gran ciudad española donde más han disminuido los contaminantes atmosféricos en 2021. Concretamente, un 17% de disminución en dióxido de nitrógeno y un 27% de disminución en partículas PM10. Barrios pensados para una vida saludable en todas las etapas de la vida, especialmente para la gente mayor y los niños y las niñas. Barrios facilitadores de estilos de vida activos y saludables como andar y hacer deporte, en contacto con la naturaleza y en conexión con la huerta, el río o el mar. Barrios que apuestan por una movilidad activa y no contaminante, como caminar o ir en bici. Barrios donde la alimentación saludable y de proximidad es un valor y está al alcance de todo el mundo. Con un urbanismo integrador, espacios públicos de calidad y viviendas accesibles y confortables. Barrios cohesionados para vivir y para convivir con fuertes redes ciudadanas y comunitarias que fomentan la salud física, mental, emocional y relacional de las personas. Incorporar la salud en todas las políticas municipales requiere un trabajo interdisciplinar y también de fuertes dosis de innovación en la configuración de un modelo de ciudad verde. Así es como hemos planteado en Valencia, y prueba de ello es que esta misma semana estamos defendiendo nuestra candidatura para ser Capital Europea de la Innovación 2022 y Capital Verde Europea 2024. Para nosotros, estas dos cuestiones están necesariamente entrelazadas en el desarrollo de una ciudad saludable. Como alcalde de Valencia, estoy encantado de darles la bienvenida a esta 18ª Conferencia Internacional de Salud Urbana. Es una gran oportunidad que ustedes puedan conocer de primera mano las iniciativas que estamos impulsando en la ciudad y que nosotros podamos aprender de sus aportaciones, de sus conocimientos y de sus reflexiones. Y decirles que como ciudad estamos encantados de recibirles y acogerles, porque esta es la esencia de nuestro carácter plenamente mediterráneo. Y por supuesto, les invitamos a explorar y disfrutar de nuestro patrimonio gastronómico, cultural y natural, que seguro que no les va a defraudar. En este sentido, les deseo unas excelentes jornadas de trabajo, pues estoy seguro de que todas las comunicaciones y proyectos que van a presentarse van a resultar extraordinariamente enriquecedores e inspiradores. Muchas gracias y bienvenidos.
I don't think we could have chosen a better place to come with a mayor that can say in a municipality, in a university that can say all that in terms of health and all policies, environmental determinants, well-being, physical activity. I think this is all music to our ears, and I think we came to the right place. Thank you, Mayor. Mayor. We now have a video from the Director General of UN Habitat. And we have, as a society, been collaborating with UN Habitat over many years and in many circumstances. And we're very pleased to have a video from Maimunah. She will now have a video being played. Maimunah Mohd Sharif is the Director General of UN Habitat. Over to you, Laura. So I'll introduce to you, while we wait for Nairobi to be present with us, I have the pleasure to introduce Laura Soto, who's the Secretaria Autónoma de la Arquitectura Bioclimática y Sostenibilidad Energética, for your intervention. Thank you, Laura. We're very pleased to have an architect who's a leader in bioclimatic architecture here with us.
Buenos días a todos. Alcalde, rectora, directora, presidente, organizaciones y todos los que estáis aquí, incluidos los que nos estáis viendo por streaming. Bueno, pues en primer lugar es un honor que nos hayáis invitado como representante del gobierno. Una cosa, me estoy escuchando por aquí, ¿es posible arreglarlo? Es que me escucho con eco, es tremendo, vale. Es un honor haber recibido la invitación como representante del gobierno regional a este evento organizado por la Sociedad Internacional para la Salud, que como ya se ha dicho, celebra 20 años de existencia y con este congreso se cumplen 18 ediciones de un evento que está tan en línea con lo que yo represento en el gobierno de la región. Quisiera agradecer también la implicación del Ayuntamiento de Valencia, así como la Universidad de Valencia, que sé que ha puesto todos los medios para que se pueda celebrar aquí. Hace casi 80 años, en octubre de 1943, Winston Churchill estaba pensando cómo reconstruir la sala de la Cámara de los Comunes y dijo: nosotros damos forma a nuestros edificios y después nuestros edificios nos dan forma a nosotros. Esto es de crucial importancia porque si lo trasladamos al entorno urbano, podemos decir que la forma de la sociedad se impregna de la forma en la que constituimos lo urbano. Además, como ya se ha comentado aquí, me gustaría recordar, y hoy venía escuchándolo cuando venía de camino en la radio, que es el Día Internacional contra el Cambio Climático. Por lo cual, la forma en la que diseñamos nuestras ciudades no solo es un medio para luchar contra el cambio climático, sino es una manera de que nos veamos menos afectados por el cambio climático. La segunda cosa que quería comentarles, como no puede ser de otra manera, porque ya se ha dicho, porque represento dentro del gobierno valenciano un departamento que trabaja en la arquitectura bioclimática y porque yo misma de formación soy arquitecta, la importancia de la arquitectura en todo este proceso. Es verdad que lo urbano es un proceso multidisciplinar, por eso están ustedes aquí, investigadores de la salud, de lo urbano, de la movilidad, de la vivienda, pero la parte de arquitectura es una parte crucial en el diseño de entornos urbanos saludables. Este año la Organización Internacional de Arquitectura, celebrando su día el primer lunes de octubre, tenía por lema Diseño para la Salud. Yo creo que no puede estar más en línea la celebración del Día de la Arquitectura, hablando de diseño para la salud, con el tema que hoy les va a ocupar aquí en estos días. La importancia del diseño arquitectónico y de la planificación urbana en la salud física y mental del urbano. Y porque también atañe a otras competencias lo urbano, como es la sostenibilidad, la eficiencia energética, las cuestiones de género, la accesibilidad. Y eso me hace hacerles una llamada de atención, porque tanto como en la web, cuando la estuve estudiando, vi que el lema de este año, que lo tienen ustedes ahí, recalcaba 3 palabras que yo creo que están muy en línea con el rol que tenemos que ejercer desde la arquitectura, que es Global Community, Action y Equity. que también está muy en línea con el movimiento de arquitectura que se está promocionando desde la Unión Europea, que es la nueva Bauhaus europea, que habla de Beautiful, Sustainable Together. Por último, me gustaría destacar la importancia del rol de las administraciones públicas en el diseño de la salud para las ciudades. Todo lo que debatan ustedes aquí es estudiado con cuidado por los que formulamos políticas públicas, que tenemos esta gran responsabilidad. Pero yo creo que desde el Gobierno valenciano, además de ayudar a los municipios en el diseño de sus estrategias con financiación, también les ayudamos en el diseño, en generar guías, en generar plataformas GIS de datos, en diseñar desde la perspectiva de género, desde la accesibilidad, como he dicho, desde la sostenibilidad energética, pero sobre todo en el compartir buenas prácticas. Es muy importante desde lo municipal compartir buenas prácticas y los casos de éxitos que sean conocidos. Lo estábamos hablando antes de iniciar la jornada, lo importante que es ahora esa global community, ¿no? Compartir buenas prácticas de aquello que es caso de éxito que se pueda replicar. Y por eso yo creo que la administración pública, la administración valenciana en este caso, tiene un papel muy importante de impulsar todas esas políticas, esos instrumentos y además empezar a incorporar pues, la compra pública innovadora o la compra pública verde. Porque como yo siempre digo, si no licitamos de manera distinta, las cosas no van a ser distintas, un poco al hilo del martillo de Maslow, que si siempre utilizas un martillo, la solución siempre se va a parecer un clavo. Pues debemos huir precisamente de ese pensamiento. Para concluir, el futuro que queremos incluye ciudades de oportunidades, con acceso a servicios básicos como la energía, tan en boga en estos días, la vivienda, el transporte y más facilidades para todos. La arquitectura sostenible es la arquitectura saludable y es el vehículo más adecuado para conducirnos hoy al mañana que deseamos. Y esta es la apuesta, de nuestro gobierno, del gobierno valenciano, nuestra apuesta. Les deseo una feliz jornada.
Muchísimas gracias, Laura. Un placer también tener la región, el gobierno regional integrado. We now have the pleasure of having Sharif.
To be with you.
Can you restart again, please?
Excellencies, honorable guests, distinguished delegates, colleagues, friends, ladies and gentlemen. It gives me great pleasure to be with you at the opening of the 18th International Conference on Urban Health. 3 months ago, the United Nations General Assembly declared healthy environments a human right, a right that has been heavily challenged by the COVID-19 pandemic and other emergencies. This gives citizens more leverage to uphold their rights as a global community to drive actions and ensure equity, making the theme of this conference even more important and timely. Today, urban centers are exposed to the risks induced by climate change, which poses one of the foremost threats to urban health, particularly when combined with poor access to medical services, water, sanitation, adequate food, decent housing, and healthy mobility. The pandemic has shown us how urban contexts and existing inequalities have played out in terms of response, resilience, and recovery. Many factors that influence health and well-being are determined by social, environmental, and economic policies beyond the direct control of the health sector. This is why multi-sectoral actions and decisions on housing, transport, energy, land use planning, urban agriculture, and waste management all have significant positive health impacts. Many studies have generated valuable findings from all parts of the world for a better understanding of health inequality. We need to make sure that these insights are translated into actions and support policy innovation and local solutions. At UN Habitat, we know that academic researchers, educators, and practitioners not only have a crucial role to play in achieving global health goals, but are also key actors towards creating more healthy living environments. Through this conference, we all have the opportunity to strengthen the link between researchers, planners, and decision makers, and ensure that science contributes to driving local actions and informed policy. This is a step closer to bringing us to healthier times. I wish you a fruitful conference and success in your deliberations, and hope further collaboration will be forged over the next days. Thank you.
And we now have the pleasure to have the Director General of the WHO, Dr. Tedros Ghebreyesus. The WHO has been a strong worker, advocate in a number of areas of urban health. We're collaborating very closely with them for many years, and we're very pleased to have many colleagues from the WHO here with us during this conference. So, Dr. Tedros.
Excellencies, distinguished delegates, dear colleagues and friends, cities are central to our societies and economies, transport and environment. They're also central to our health. By 2050, nearly 70% of the global population will be living in cities, according to the most recent projections. Health is influenced by many factors beyond the health sector, which is why urban and territorial planning is critical for the health and well-being of people who live in cities and surrounding areas. This makes sustainable urban development and urban health a key priority for long-term planning and programming. This conference is an important opportunity to share your lessons and experiences with each other, and will inform the work of WHO. WHO is committed to supporting countries and regions to address urban health issues and to continue our participation in global efforts to improve urban development. We welcome mayors, local and national authorities, and all urban leaders to work with us to create healthier and more resilient societies. I thank you.
And now we have the pleasure to invite la Rectora Magnífica de la Universidad de Valencia. That is, she is the president of the University of Valencia. She is the overall boss of the university. And we are delighted to have you here with us today. Maria Vicenta.
Bon dia, buenos días, good morning. Excelentíssim alcalde de València, estimat Joan, secretària autonòmica d'Arquitectura Bioclimàtica i Sostenibilitat Energètica, Laura, vicealcalde de l'Ajuntament de València, estimat Sergi, vicerectora de Sostenibilitat, Cooperació i Vida Saludable de la Universitat de València, estimada Pilar, director de la International Society of Urban Health, doctor Carlos Dora, directora ejecutiva de esta conferencia, investigadoras y investigadores, profesoras y profesores, científicos y científicas, participantes en esta conferencia internacional sobre salud urbana. Bienvenidas y bienvenidos a Valencia. Welcome to Valencia. Bienvenidas a una ciudad cosmopolita, a una ciudad surgida del cruce de civilizaciones que la han habitado a lo largo de toda su historia. Ciudad que tuvo una notable importancia como la Valencia Edetanorum romana y como la Balanaya musulmana. Ciudad que vivió en el siglo XV un singular apogeo económico, cultural y artístico, en una época de la que data, entre otros hitos, la creación del Estudi General, lo que hoy conocemos como Universitat de Valencia. Una ciudad que fue capital de la Segunda República Española durante la terrible guerra civil que vivimos y que hoy en día es una ciudad que conjuga tradición y modernidad, que combina los servicios de toda ciudad del siglo XXI con unos monumentos, edificios y jardines con los que pocas ciudades cuentan. Una ciudad, Valencia, que tiene un vínculo muy fuerte con su universidad, la que creó en 1499, la Universitat de Valencia. Y es que Valencia, como ciudad, y la Universidad de Valencia, como institución, han crecido conjuntamente. Así, nuestra universidad se integra en la trama urbana de la ciudad sin que pueda entenderse a lo largo de la historia la una sin la otra. Me permitirán que destaque la estrecha colaboración de la universidad con las instituciones del gobierno regional y municipal, que en materia de salud existe y ha existido desde el origen de nuestra universidad a principios del siglo XV. En Valencia nació el primer hospital psiquiátrico del mundo a principios del siglo XV, un hospital para acoger a todos los locos y discapacitados en la terminología de aquella época, que carecían estas personas de cualquier tipo de asistencia. Ese hospital es hoy el Hospital General de Valencia. En el edificio fundacional de la Universidad de Valencia, nuestro Centro Cultural La Nau, hay una exposición que hemos titulado La Nau dels Bojos, la nave de los locos, que hace que sea todavía más recomendable la visita a un edificio con más de 5 siglos de historia. Como ven, las actuaciones de salud pública y mental tienen en Valencia un origen renacentista, estrechamente ligado a nuestra universidad y que aún hoy perdura ese espíritu. Y relevante es también, y por último, el papel que destacadas figuras de la Universidad de Valencia tuvieron en pandemias anteriores, como la del cólera a finales del siglo XIX. De hecho, el doctor Manuel Candela, profesor de nuestra Facultad de Medicina y también rector de la universidad, llegó a establecer en su casa un laboratorio para trabajar en lo que por aquel entonces se llamó vacunación Ferran, en un proceso que permitió obtener una gran ventaja en la lucha contra la enfermedad. Pero volviendo al presente, hoy en día la Universidad de Valencia es la más prestigiosa de la Comunitat Valenciana y una de las mejores de España. La primera universidad de Europa en recepción de estudiantes Erasmus. Somos una de las 5 mejores universidades de España y a nivel estatal somos líderes en competiciones deportivas del estudiantado y en número de estudiantes con discapacidad, que gracias al esfuerzo y al compromiso ético de la institución pueden desarrollar su trayectoria académica en plenitud. Una institución con más de 5 siglos de historia y a la vez una institución moderna, que adapta sus instalaciones a nuevas exigencias derivadas de los ODS, como hemos hecho estos días al someter a votación la remodelación de nuestro campus más moderno para hacerlo más sostenible, más accesible y más amable para la comunidad universitaria. Una institución flexible, adaptable a circunstancias excepcionales como las derivadas de la pandemia, durante la cual mantuvimos un funcionamiento a distancia ejemplar que cumplió, gracias a un esfuerzo de toda la comunidad universitaria, con las exigencias de una formación de excelencia. Y que además llegó, para conseguirlo, a proporcionar dispositivos y conexión a Internet a estudiantes que, por lo imprevisto de la situación, no contaban con lo necesario para seguir esas clases online. Y una institución que en una materia como la salud y la sostenibilidad estamos, según el ranking de Shanghái, entre las 150 mejores universidades del mundo en medicina clínica y estudios atmosféricos. Y somos una de las 200 mejores universidades en consecución de los ODS, según el ranking Times Higher Education Impact. Por citar solo dos de los ejemplos. Es un honor para mí, como rectora, que la Universidad de Valencia albergue esta 18ª Conferencia Internacional sobre Salud Urbana. Un asunto de plena actualidad, un asunto de máxima relevancia para el presente y el futuro de las ciudades y de las personas que las habitamos. Algunos de los retos y amenazas que afrontamos como sociedades, como el cambio climático o la crisis energética, afectan directamente a la salud de los y las ciudadanas y también a la manera en que nos desarrollamos como comunidades humanas. Cuando todavía nos preguntábamos si efectivamente saldríamos más fuertes como sociedades de la pandemia, la guerra en Europa, iniciada por Rusia, impensable hace unos años, ha hecho crecer la preocupación sobre ciertos temas que nos perjudican a todas las personas. La movilidad urbana, la relación de la ciudadanía con el consumo de productos y energía, la distribución de los dispositivos de generación de energía verde en el territorio, la relación entre una ciudad amable y sostenible, la calidad de vida de las personas, son temas sobre los que hay mucho que decir, mucho que aprender, mucho que compartir, mucho que trabajar. Por eso, encuentros como el que inauguramos hoy resultan esenciales para avanzar en conocimiento y también en la transferencia de este conocimiento a la sociedad. Y es necesaria esa transferencia para compartir estrategias, para recordar errores y evitarlos en el futuro, para ser eficientes, para que el futuro sea de una manera u otra gracias a nosotros y no a pesar nuestro. Gracias a quienes han hecho posible que este encuentro tenga lugar en Valencia. Desde el Vicerrectorat de Sostenibilitat, Cooperació i Vida Saludable, a quienes como decanos, profesoras y profesores han trabajado en ello. Asimismo, gracias a las autoridades que nos acompañan, en especial al alcalde de Valencia, a la secretaria autonómica, porque su presencia confirma el prestigio del encuentro y garantiza que podemos trabajar conjuntamente para aplicar lo que aprendamos de estas jornadas. Gracias también a todos los participantes, a todos los ponentes por enriquecer con su presencia y su actividad esta conferencia internacional. Y gracias sobre todo a la International Society of Urban Health, porque de la salud de nuestras ciudades depende nuestra salud, depende nuestro futuro y todo lo que nos importa. Depende la calidad de vida de todas las personas. Su trabajo es imprescindible. Espero que disfruten de la ciudad y de los recintos en los que se desarrollarán las actividades, especialmente el Jardí Botànic de la Universidad de Valencia, un lugar en el que evadirse del bullicio de la ciudad en pleno centro da toda una oportunidad. Y espero que hagan importantes avances en los temas que se van a tratar aquí. Nos jugamos mucho como personas y como sociedades. Y ahora sí, declaro inaugurada la Conferencia Internacional en Salud Urbana, ya en su 18ª edición. Muchas gracias.
Mira, yo creo que tenemos una foto juntos aquí. Pregunto a Giselle si vamos en algún momento vamos a tener fotos de todo el grupo también. Sí, el grupo que vino de la municipalidad, de la universidad, de la región.
A ver. Tengo que salir, lo minimizo, ¿no?
Y después seguimos. Vamos a hacer una pequeña introducción después de esta parte. Hacemos una pequeña introducción a Giselle y yo sobre la conferencia, ¿de acuerdo? Y ya les damos café pronto.
A ver, estamos silenciados, ¿eh? Estaba silenciado y se seguía viendo arriba. No entiendo nada.
Thank you for the messages which are saying how glad people are for having that we chose Valencia as a city. I think we're all very pleased with that. And so now we proceed with a bit of an introduction, a bit of reflection. We haven't been together physically since Xiamen, so it's since 2019. So we had a conference last year, but it was electronic. So I think just a bit of stock taking on our side. I'll speak first, and then Giselle will speak immediately. Oops. Takes a while. So I don't know how many people are members who are sitting on the audience. So we're a member organization, but we're also a network. So there's people who are part of the network and some are members. We will have a members meeting on Wednesday evening at 6 to 7, where we're going to be hearing from the members what they would like to have more from the organization. And there's also, in terms of business, there's the Expert Advisory Council, which has just been renewed, and they will also, or we will also be meeting over lunch on Wednesday to discuss, the more of the business part of the organization. But just to remind, I don't know how many people have been here before, but this is the organization which is focused specifically on the broader determinants of health, that is environmental and social, across disciplines and sectors, improving health and equity in cities worldwide, to achieve greater impact and a better urban future for all. So that encompasses cities and citizens. So reminder, a few items of progress. So I'm really happy that as we're meeting after Xiamen, after 3 years, that has been, so much progress has been made. I think Giselle, Sebag as the executive director, and with staff who are fully committed to the organization is a great achievement. We haven't had that in the history of the organization until now, in terms of dedicated staff fully working in that direction. And I think she's hit the ground running and is been making a number of connections. I mean, as you know, Giselle comes from architecture. A number of the people in the association comes from public health. And we're bridging making a lot of links with all the organizations who are, and some of them are present, some of them are not in our expert advisory council in terms of placemaking, children's health, youth and urban equity, so in a range of issues. So that's, for me, a major achievement, and that provides strength to the organization moving forward. I'm also very pleased that the Expert Advisory Council has been renewed and is still reviewing the strategy, etc. But I think that will provide a lot of insight, but also direction for the organization. And the fact that we're broader and more cross-disciplinary will also be extremely helpful. We're now in the process of defining flagship projects and reviewing the strategy. The third point, which I think is very important, that we now have a fiduciary board, which has been set up, is led by Joe Buford, is chaired by Joe Buford, and is specifically looking at funding, due diligence over ISUH operations, and the fact that this is now in place under Joe's leadership is also very beneficial. So I think we're, from a members and volunteers organization, we all have transformed ourselves into an independent NGO. We're still collaborating very closely with the New York Academy of Medicine, but we're not there only. And that reflects the global nature and the membership of the organization. A lot of people are in the South. A lot of people are we still have members in the North, but it's very varied. And I think we're getting back to recuperating the strength of having that membership and being present in the field everywhere. So the way we've been doing that, and we started that over the last year and a half, we've been doing global projects with members of the organization. So we're in the second project now that specifically builds on the regional networks and the regional expertise. Although we've been piloting that, we're very, very pleased with the results, and I'll give you some of those results. So in terms of progress, I couldn't be happier as a president. I think I can relax and, and sort of, because in terms of where we're going, I think is the right place. We feel that our role as a global network is quite unique. And I think that what we want to do with that network is really to strengthen and to enlarge it. The second role that we have been having very clearly is to generate and disseminate evidence, learnings, and knowledge. But a third role that we can, and we want to enhance much more, is the mobilizing and leading global urban health movement through engagement, through partnerships, and through advocacy, which again, we have much more academic and less in that space of creating change. I think the business of catalyzing the knowledge that we have and translate it into practice is right at the center of where we are today and where we're needed. considering this not only climatic circumstances, the relief of, but also the social, the equity issues, the moment that we live historically, where we're much more aware of issues of race, of gender, of colonialism, and where we can, as a society, as a global society, embrace those issues and work towards the solution as a group and as a collective. So the projects that, these are the list of conferences for those who haven't been here before. This is, we started, quite some 20 years ago, and we have a number of conferences, normally is once a year. One of the projects that I was going to mention, that I'm going to mention, is the one that we developed with WHO, where we looked at research priorities and gaps. But the way we've done that, and we helped WHO in their identification of gaps, was to draw on regional networks and on the expertise of the society. And for those of us who have been involved, and now the results are going to be coming out, I believe, Natalie, very soon, I think it was a real pleasure to know the depth of understanding, the depth of insight that people in the region have. And I think that's what motivated, I think, me personally, but also us in the society, to move further into sort of drawing upon that and reinforcing that capacity. The project that we're now engaged on is with Robert Wood Johnson Foundation, is around health equity and around urban equity. And how is it that has happened? Who are the actors? What were the policies in place? What is the mixture that led to that happening? In creating not only analysis which compare informational data, but also comparing the stories and creating the narratives that come from the South and draw on this broad network. Those are two examples, and I think I'll close with some reflections of where we are today. I think we have used the Dahlgren and Whitehead model of social determinants of health for many years, and has been an inspiration, is still very present and useful. It draws more from an individual perspective, and how is it that people are affected by different factors. But we're now in a moment where we do know all the planetary boundaries, but we also know that the planet doesn't live without the people, or it's affected in a major way by the people who live in it. So the idea that the environment is important is key, but the idea of the social mechanisms there whereby we influence that environment is central. And I think Kate Raworth in her Donut Economics made that point very clearly. There's a last report that just came out last week, the report, which is Earth for All, which is Club Rome, and is 20 years after the Limits to Growth report. 20 years, no, 50 years after the Limits to Growth. This is mostly macroeconomic analysis, and those who like models will be delighted by the number of connections which are made in the models. I do recommend that for those who like it. But the important part, and the reason I'm bringing it here, that it does bring empowerment, poverty, equity, very much together with climate change, with food, with energy. So it's not that we're talking across purposes. And although a lot of people in policymaking or in science would necessarily focus somewhere, there's got to be a place where those connections are made. And for me, I think that's the modeling. I won't horrify you with the details. But it's interesting to know that in this report, the Club of Rome, although the modeling is very sophisticated, and when it comes to the decision making, when it comes to making, these are the recommendations for action. And one of the 4 key recommendations is taking action locally. I joined a local group of movement. Global transformations are connected to deep local changes. And I think for us, I see that's the main message. And what is it that we as a society can bring in a moment where there's so much confusion, I would say, because of fake news, and national governments sometimes go astray. And I won't mention which ones because there are too many of them. So I think cities have a very special role, and it's not only the big and shiny cities or the ones who are part of some global networks. I think it's everyone in every city. And there's thousands of cities, and there's thousands of people who are very eager to engage and to create change by putting knowledge into practice. So I think the society, as I see as the focus of our attention from now on, or has been, but I mean increasingly so, is to be able to make those links, to share those experiences, but to really work as a network that is trying to move into action. So I already offered the mayor that we can lobby for his candidacy of, Green City or whatever. But I think the lobbying part is very important. I think we have to draw on the local perspectives for local transformations, for making local connections. But globally, I think we can have a very great say and can make a very big input. So I thank you very much for being here. I welcome you on a personal level. I'd say that some of us are not here who should be. I'll mention Paul Wilkinson, because he contributed to many of the work which are here today, and he was supposed to be speaking. Housing, energy, air pollution, and I think the fact that there's so much of his work which is here in the various sessions, it speaks for what is it that we bring and why is it that we are together. Because we can continue and we can enlarge. And I'm sorry to be emotional. I thank you, and I invited Giselle, who's much to welcome me in her words, and to bring the news as well, also the practical news about the meeting and how we're going to be gathering together. So don't forget, the members on Wednesday evening at 6, the dinner, whatever is later. So it's not as it is written in the program, it's not at the same time. So only after the members meet, and the meeting is going to be in this room, and the Expert Advisory Council is over lunch in the cafeteria in the open air. So it's a fresh conference from the point of view there's a lot of open air, there's gardens, there's terraces, and there's a city which is very welcome. Thank you for being together. And Giselle, over to you.
Muchas gracias, merci. Thank you so much, Carlos. Buenos dias to everyone. Good morning. Bienvenido a todos. For those of you I haven't met yet, my name is Giselle Sebag, and I'm trained in architecture, urban development planning, and in public health, dedicated to improving urban health by design. And I have the pleasure of serving as the first ever dedicated executive director of the International Society for Urban Health. For the past 20 years, the International Society for Urban Health has been the only global non-governmental organization dedicated to advancing our mission to work across disciplines and sectors to address the comprehensive urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. What an incredible moment for us all to finally be here together in beautiful Valencia. We want to thank again so much Mayor Ribó and his administration, the Generalitat de Valencia and the University of Valencia for agreeing to partner with us to make this dream that we had a reality. And of course, to our dear colleagues at Adhanom, who have worked tirelessly day in and day out alongside us to put this event on. We're so grateful to all of you, Barbara, Maria Jose, Cristina, Belen, and the rest of the team. And to our fabulous ISUH team, who've been working so hard, to Gerard, Carolyn, Anna, Sydney, Gina, Aurelia, and Mariana, who've literally put their entire lives on hold to help organize the logistics of everyone coming together this week to celebrate our past and all that is ahead in urban health. Finally, I want to give a huge, huge thank you to all of our sponsors, the Robert Wood Johnson Foundation, Impact on Urban Health, Novo Nordisk, the Novartis Foundation and Botner Foundation for supporting us and for putting on the coffee breaks, the site visits, and for the incredibly generous scholarship funds that we were able to use to bring the best and the brightest emerging urban health scholars from around the world to take part in ISUH. And we couldn't possibly imagine, as Carlos said, a better host than the city of Valencia. Over the past 20 years, the city has completely transformed its politics, its infrastructure, and its approach, and it is now world-renowned for its green and natural spaces, the public squares that we have here, its bicycle infrastructure, and the warm disposition and friendly, welcoming nature. So we really do hope that you'll take some time to get out and explore the city, maybe take one of our tours or one of the site visits that we're offering to get inspired from real life examples of transformative changes that have resulted in improved health, equity, and prosperity for many citizens and for visitors alike. So we have been planning this moment for more than a year. And after the pandemic, we didn't know if anyone would even want to come. So we are absolutely overjoyed to report that our initial anxieties were totally misguided. And we have completely sold out to the point where there is no more capacity. The two spaces that we reserved for this event, the La Pachina Sports and Cultural Complex, where we are now, and the lush and beautiful, if you haven't been there yet, the Jardín Botánico, which we have for the other half of our events that are taking place over the week. I'm interested. I want to get a show of hands. Could anyone raise their hand if this is the first ever international conference on urban health that they've attended? Wow, it's a lot of new people. And can you raise your hand if you've been to 2 or more? Oh, that's a lot too. I'm impressed. Wow. So there's so many people that have really been with us since the beginning and have seen it grow and evolve into something new. And we're also so delighted to see all of the new faces and those of you who've found us this year. We're so delighted to have you. So thank you so much. We hope that in the future, you'll be one of those that comes to more than 1 or 2 or maybe even 3. And so, in fact, the turnout for the 18th Annual International Conference on Urban Health has completely exceeded our highest expectations. We have with us more than 500 people who are coming in person, representing perspectives from over 57 different countries. So people traveled so far to get here, from near here in Valencia, Barcelona, Madrid, but also really far away. Some people traveled for more than 55 hours to get here, including from New Zealand, Australia, China, Thailand, Bangladesh, India, Zimbabwe, Ghana, Kenya, South Africa, Chile, Brazil, Colombia, Mexico, the United States, Canada, Poland, Morocco, and many others. And we have a really diverse mix of people here. So we have mayors with us. We have health and urban development ministers. We have university deans and rectors, as we saw this morning. We have professors and researchers, philanthropic foundations, development agencies, public health consultancies, architects, urban planners, placemakers, guerrilla urbanists, urban data scientists, real estate companies, sustainable development NGOs, grassroots leaders, and organizations at the grassroots level, and more. By far, this is the most diverse attendance of any international conference on urban health in history, and we're so excited about that. Everyone has been motivated to spend their truly valuable time and energy gathered together to learn and exchange knowledge and hopefully spark new ideas over the next 4 days. And we have more than 120 different events to do that in, but also I'm sure you'll find opportunities just, meeting people in the garden and chatting over coffee, because strengthening global urban health knowledge and working together to form partnerships among academics and government and practitioners so that we can translate the evidence that we have into actionable policy and a positive impact on residents, it is critically important for all of us across all sectors and disciplines. And I think we can all recognize that now more than ever, and I think the pandemic has really shown us in many ways how vital our work really is, to create healthier and more equitable and sustainable environments, how important that really is for people all across the world, regardless of their background, of their age, of their gender, or their socioeconomic status, or most importantly, I think in many ways, their zip code, where they live. Everybody regardless of any of those things, should have the same opportunity to live a long and healthy and fulfilling life. So for decades, the International Society for Urban Health and our conference we've worked together to gather this strong body of evidence and research that we have to help us understand how we can best improve health in urban environments worldwide. And we've been working on it for so long, and there is so much good evidence now, but yet we still know that gaps exist in knowledge generation and in translation and in application for urban design, development, and public health practice. Cross-sectoral collaboration and multidisciplinary training and action are needed. They're necessary for us to actually bridge the disciplines together and to better define urban health within a global context. And the International Conference on Urban Health, we hope that we can serve as that global convergence point to advance and support the generation, exchange, and application of urban health programs and policies with the majority of our participants, and this is something that I'm so proud of, but the majority of our participants hail from lower and middle income countries around the world. And so we are so proud to be one of the only places that's including that important knowledge and those incredibly unique and important perspectives that are so often overlooked. So we are back in person for the first time since 2019, and we're so delighted to meet in 3D, as some people say, to actually meet in person so that we can connect and we can share the cutting edge research and the innovative ideas that you all have, the stories and the on-the-ground examples of how we can come together as a global community of urban health practitioners, activists even, some of us, to achieve the greatest positive impact that we can possibly have on resident health, well-being, and equity in urban settings. And so we did choose our theme, growing our global community, driving action, and ensuring equity, with that simple idea of doing just that. So during this year's conference, we really do aim to connect all of the global stakeholders that are working within the urban health realm, and there are many, and they're so diverse, and to drive action and equity across cities and regions that we all live and work and spend time in. And we're going to explore how urban health can connect with the other urban global agendas, such as climate change. We're going to be talking about that later this afternoon, planetary health and sustainable development. And we're going to continue to explore models for engagement and for empowerment and prioritizing and defining equity across communities, how biodiversity and natural elements can play a role in healthy urban futures, and ways to reduce climate impacts for all of those things and more. And although, just so you all know, although ISUH 2022 is taking place mostly in person, we are also offering a selection of sessions for viewing and for virtual presentation online. So this one is one of the many that is being streamed online that anyone can view, and that's being recorded, and you can see it afterwards. And our amazing program team worked really hard this year to include more practice-oriented discussions and workshops and special exhibitions and site visits to local projects than we've ever had before. So you can really be on the ground and experience some of the examples that we can find here. Our two venues, so the Botanical Gardens that you're going to see later today and the La Pacina Cultural Sports Complex, where we are now, offers also innovative examples of health and action and inspiring ways to see healthy environments and how they can support improved experiences for the conference. So you're going to be able to actually see that. And so with that, I have a few logistical reminders about our time together, maybe a little less important, but just so that we all know. So we do have these two different venues, but all the plenaries and all the lunches are here in this venue right out in the hall. And this building also, if you can, try to learn a little bit about the history. There's some signage along the corridor when you go outside. But it's an adaptive reuse building with this incredible story of transformation, much like the city of Valencia itself. And then during all of the parallel sessions, we have up to 12 different sessions going on at any one time. And they're held both here and virtually and in person at the University of Valencia Botanical Gardens. And the gardens, you'll become familiar, I'm sure. They're only 800 meters away. It's about a quick 10-minute walk along 2 streets. So there's some maps in the programs and guides for you. And we have volunteers who are wearing blue vests with our conference logo on them also, who are going to help you show you the way so you can not you can make sure you can navigate to the other venue. So look out for them if you have any questions. And I think, yeah, maybe your first time, you'll be a little turned around, but then I'm pretty sure you're going to get it for the rest of your time here. But we are all here to help you all, and we're happy to help you navigate or to answer any questions, because we do have a lot of events going on, which we're very excited about, but we want to make sure you can get to the places that you want to go. Another note, important, the coffee breaks are held both here, but also at the Botanical Gardens. So while the lunches are only here, the coffee breaks are in both locations. So if you're seeing something or you're at an event at the Botanical Gardens, you can make sure that you can get your coffee break there. You'll never be left without coffee. We promise you. That's very important. One excellent benefit that I want to let you all know about of using the Botanical Gardens as our second venue is that by showing your badge, so just try to keep your badges visible at all times if you can, but with that badge, you actually have complimentary access to the garden for the entire week for you or your families to just enjoy. And so really do feel free to walk around the grounds during the coffee breaks or in between sessions to enjoy all the nature that there is to take in, even though that we're in the middle of a city. It's pretty beautiful and amazing, I feel. You can get so much green in nature, you know, even within the city center. And then La Pachina is also a fabulous public space that's open to residents and open to the public. It has sports centers and a library. It's absolutely amazing. But with that, I will remind you that both of our spaces are also open to the public during our conference time together. So just please keep your personal belongings with you. We wouldn't want anything to go missing. Just don't leave them unattended in either of the venues, because we do have public coming in and out. Of course, we have Wi-Fi available at both venues. So the QR codes are posted all around. So here, the QR codes for each room will work if you just scan it. But at the gardens, if you have an Apple device, you have to actually type in what the username and password is. So it still works just fine. You just have to go through that one extra step of typing in. I just want to let you know, don't panic. There is Wi-Fi. We'll just get you the login details for that. For presenters, I think you've gotten emails. So just to be repetitive a little bit, if you're using slides, just try to upload them at the registration desk in the morning or upload them on the cloud drive that we have. So all of those details are in the email, but of course, ask us if you have questions. And then we have a bunch of site visits, which we're really excited about. But if you're interested in going on a site visit, there are some limited spots. So make sure you stop by registration and you sign up for which site visits you want to go on. And we'll tell you where all of them are leaving from, but they're going to be leaving from the reception halls in both of our venues. Carlos noted this, but I'm just going to say it one more time. There's one mention of the gala dinner that's happening on Wednesday, and it's in the program. It says it's 6 o'clock, but it is not 6 o'clock. It is 8 o'clock. So, don't be confused about the gala dinner timing. That was the one thing that we just wanted to make sure you knew. And then also, we don't have transport going from the venues to the gala dinner because there's a little bit of a gap in between. So, talk to us if you want to have a good idea of how you can get to the venue. There's many options, public transport and cycling, or even a taxi. So just let us know. Attendance certificates, if you're wondering about those, they're going to be issued after the conference and sent by email. And then last thing, for those of you who are using the translation headsets today, and for any of the other sessions, if you can just remember to drop them off when you leave, we have volunteers that'll be collecting them by the doors. Just so you know, you're all invited today to the welcome reception. It's going to be held right out these doors and down the corridor towards the Sala de Conferencias today at 6:30. So we're so excited to have you there. Okay, and with all that sort of boring logistical stuff out of the way, just to say again, we cannot wait to learn and to be inspired by each other throughout the week. On behalf of all of us at the International Society for Urban Health, thank you, thank you, thank you so much for being here with us, and for your vital contributions to the field of urban health, and for working with us to build this community of practice together. I believe that coffee is set up right outside these doors for you. So with that, we just really hope that you enjoy your time together with us, and thank you for being here.